Hi, I'm Dr. Miner. Today I'm here with a patient that we are going to do a Kybella treatment for. Kybella addresses the fullness under the chin. Now we've already done one treatment. With the first treatment you really don't notice much difference. Do you notice much difference?
No, not after the first
No.
treatment.
So it usually takes 2 times before we start to see a change in the fullness under the chin, where it starts to decrease. Now tell me, after the first treatment, soreness is common, the swelling is common. Did you have the soreness under there?
Yes, I did have some soreness under there.
Okay, and how long did that last?
Probably lasted 2 or 3 weeks.
2 or 3 weeks. And what about the swelling?
The swelling was about the same
About
too.
the same.
Yeah.
And oftentimes it's not uncommon that the feeling under here changes, kind of a little, not quite numbness, but something like that. Did you experience that?
I did. And it
Okay.
also lasted about 2 or 3 weeks.
And then that went away?
Yes.
And now feels
Yep, it feels
normal?
back to normal, yes.
Okay. So we're going to do the second treatment. Now the second treatment, there's not as much soreness or swelling with that. The numbness can still happen. But we're anticipating that after this treatment we will start to see the fullness under here get smaller. So before we get started, we're going to numb this area, and the advantage of being a dentist is we're just going to use our dental anesthetic to numb this area and make this more comfortable for her. She's going to feel little pinches in here. Greg will do a little anesthetic here. So Kybella is a fairly simple injection process. We draw some lines that are our boundaries. There's a grid that we place on there, and we place a small amount of Kybella at each dot. Alright, so we got done doing the Kybella. Went pretty smooth from our standpoint. At this point, we can see there's a little swelling going on. It's a little tender. And the way Kybella works is it breaks down the fat cells. And so this is a permanent solution to getting rid of the fat that's under there. And so it is tender because those cells are getting broken up by Kybella. But we expect a great result and a great outcome. Alright, so it's been almost 2 weeks since we did our second Kybella treatment, and there's still just a little bit of swelling there that's subsiding. But how was this treatment compared to the first?
I felt like the second treatment went a lot smoother than the first time around I got it done. The first time around it seemed like the soreness lasted about 3 weeks, and the swelling lasted about that long, and also the numbing, the numb feeling. But after the second treatment, seemed like that time was a lot shorter. So it was closer to a week with the soreness and the numbness and the swelling. So it was, the second treatment I felt was a lot easier than the first.
Alright, so that's pretty typical You know, the first one there was more soreness, more swelling, and then the second and subsequent treatments, this is very typical. So it's a little early to start to see the result yet, because there's still just a little bit of swelling there. And we space these treatments about 4 to 6 weeks apart. And so by the next time we do her treatment, we should see a difference, because the swelling will be down and we'll see what the Kybella has done, and we'll go from there.